Good afternoon. Can everybody hear me okay? Okay. I'm Dr. Oxiris Barbot. I'm the Health Commissioner, and I am joined by Dr. Palacio, Deputy Mayor of Health and Human Services, and we are here to make a follow-up announcement to the emergency order that was issued last week. I want to just update you that we have closed, as of today, United Talmudic Academy at 75 Ross Street in Williamsburg. They are being closed because of not maintaining and making available attendance and immunization records for both students and staff. This is a direct violation of the Commissioner's order requiring that unvaccinated students be excluded. The school will be allowed to reopen once they convince us that they are able to, on a consistent basis, keep students in school that should be in school and keep students out of school that should not be out in school. I also want to give you an update on where we are with the case count of individuals who have contracted measles. So currently we have 329 individuals that have contracted measles. 284 of these are children. Of the 44 newly reported cases, 6 have been newly contracted since the emergency order went into effect. I want to just emphasize here, as I spoke about at the press conference, that given the 21-day incubation period for measles, it's to be expected that we will continue to see cases. The other thing I wanted to note is that to date, there have been 25 individuals that have been hospitalized. 22 of them have been discharged. Currently, of 2 of the 3 that remain hospitalized are in the intensive care unit. So with that, I want to turn it over to Deputy Mayor, and she'll make a few remarks, and then we'll open it up for questions.
Thank you, Dr. Barbot. I'm Herminia Palacio, Deputy Mayor for Health and Human Services in the City of New York. I just, again, wanted to follow up on the public health emergency that the Department of Health and Mental Hygiene declared and was announced last week. Measles is very serious. The number of cases, as you just heard, continued to increase. This is why we issued the emergency declaration last week. This is why it was so critically important to have the mandated vaccine order last week. Vaccines is the critical path to ending this epidemic. Nevertheless, in the meantime, while we have all of these tools on the table to get people vaccinated, it is also critically important to make sure that unvaccinated children are excluded from schools. Today's announcement, I think, reflects the seriousness with which we have been taking this epidemic since October. The Department of Health has escalated its control measures as the outbreak has escalated, and make no mistake about it, measles is very serious. It can be deadly. Thankfully, it's not deadly yet. We are in an emergency situation, and these orders are not for show. These orders are real. This execution of this order today and the closure of schools indicates that we are very serious about following through on the Commissioner's orders. We are very serious about following through on her recent order for mandated vaccine because the current status of the outbreak demands no less from us. It demands no less. This is an all hands on deck and all tools on the table kind of experience. And as Dr. Barbot indicated, despite these tools, because the incubation period is so long, we fully expect to see the case number continue to increase over the next several weeks. Because the tools that we have put in place last week, we will begin to see reflected in the case numbers after the first incubation period. We will see those numbers reflected in the next several weeks.
Questions? So what we know about the school is that the enrollment is roughly 250 students. There are about 10 teachers. And the challenge has been with this particular school that they have been unable and or unwilling to provide documentation as required when we visit. So we have visited on a number of occasions and offered support, but in spite of all of that, it's been to no avail. And so, I want to just emphasize that we don't take this measure lightly. We recognize that school closure can potentially present hardships for families, and that's not our intent. But if a school is unable and unwilling, we will definitely close them, and so this is the first school that we are closing. They are unable to produce complete records regarding vaccination status, regarding attendance, regarding a host of measures, and in this situation, it's critical that schools play their part in excluding students who are unvaccinated, especially in the affected zip codes. They haven't given us a reason to our satisfaction, and that is why they will remain closed until they are able to convince us that they have a plan in place that we can be assured that on a daily basis they will be able to comply with the commissioner's order. And we will keep going back. I can't make a judgment on that. What I do know is that our staff have been attending and offering our support. We will continue to offer our support to this school and any other school who has challenges in excluding students. Again, we don't want it to come to this. We want schools to be able to exclude students that are not vaccinated until they do become vaccinated.
Are they telling you they cannot find the records?
So I think it's important to understand, as the commissioner has been saying, the goal of this is to make sure that we protect people. The goal is not to be punitive. These measures are not punitive. They are protective of the people who are vulnerable and at risk. So we urge all schools to join us in the effort to be protective of their students and their families and their communities.
Is this indicative at all?
Sorry.
Since the mandatory mandatory vaccination order was given, what has the relationship been with the Orthodox community? Have things been violated in activity in the last week that show that they are following this order?
Since the beginning of this outbreak, we have had a very good relationship with the Orthodox community. We are working with the Orthodox Nurses Association. We are working with the religious leaders in those schools. I have met with the rabbinical leaders of the yeshivas, and as a result, we have seen an increase in the number of students immunized as compared to the previous year. The reality is, though, that since we continue to see cases, that we needed to increase the number of public health tools that are being put into play to stop the ongoing spread of this outbreak.
I'm just wondering, what ages attend this school?
This school is for 3 to 5-year-olds.
And of the 23 other schools that you mentioned, you're just giving them violations now. They've had months to comply. Why not fine them, as you had said, or you're just going from violation to closure?
So moving forward, we will be going from violation to closure.
So I also just wanted to, I've just learned, will confirm, but as has been reported in the news, there was a suit filed in court. We are pleased with the judge's ruling. The temporary restraining order was not signed today, and the case will be heard later this month. There was, pursuant to the commissioner's order for mandatory vaccine, there was a challenge brought by an attorney. to try to get a restraining order against that commissioner's order. I am learning now that the judge has not signed the request for that temporary restraining order. The commissioner's order still stands.
You mentioned 3 people in the hospital and 2 in intensive care. Can you give us a little bit more, maybe their ages and what conditions they're in the hospital?
Beyond saying that they are stable, I can't share any more information.
Also, so you said 25 individuals have been hospitalized. What's the latest ICU number? Of
2. Total have been 6, and then the remaining 2 out of 3 that are in the hospital or in the ICU. Beyond saying that they're in stable condition, I can't really comment on that. So there have been fines levied. We could get back to you with the number. Again, the emphasis here is not the money, but in helping individuals and especially schools comply with the order.
If the vaccine is the goal, why allow parents to demonstrate immunity for children? That would tell you that the parents are likely not vaccinating their kids.
So immunity means that vaccine is the gold standard for folks who are unvaccinated and have never had the infection. So people who can demonstrate immunity either because they've had vaccine or because they've been infected in some other cases don't need the vaccine. But we want to make sure that people get the vaccine because that is the safest way to guarantee immunity. Getting measles is not a safe way to make yourself immune.
Right. But couldn't those people just get a vaccine again, other than just proving immunity? Like if you know that people
Proving immunity means
measles parties and they're getting measles and they've proven now through a blood test that they've had measles, isn't the bigger concern that they haven't had the mumps and the rubella portion of the vaccine, never mind the DTaP and whatever else?
So vaccinations are an important strategy, absolutely, for all diseases. Right now, in this current outbreak, we're very focused on making sure that we are not propagating measles.
What is the city doing to kind of refute and combat the misinformation that's out there in the form of organized conference calls and pamphlets that are being circulated throughout the Orthodox Jewish community?
So since the start of the outbreak, we have partnered with CBOs, nursing associations, and rabbinical leaders in Williamsburg. We have done a series of robocalls giving people of 30,000 households in Williamsburg, giving them correct information. We have also done a direct mailing to these households detailing all of the ways in which vaccines are safe. And we have made ourselves available to any group that's interested in having a face-to-face presentation on any questions or concerns that they may have about the safety and efficacy of measles vaccine.
And I would add that this is one place where we can really look to the media and ask that you be our partners in this. You have followers, readers, listeners who, for whom you are trusted voices. And we ask you to use that influence, that very critical influence, to get out the facts.
All those efforts you just described, would you say they're working?
So we started them since the beginning of the outbreak, and as I mentioned earlier, we have had over 8,000 individuals be vaccinated for measles as compared to the previous year. So that's great, but we need more. And so that's why with this emergency order, we really want to highlight the importance of getting vaccinated, the consequences and potential complications of measles, and emphasize that the focus here is giving parents the information they need to have them feel good about getting their children vaccinated.
I'm sorry if you answered this already, but have there been any cases that stem from this particular school that we know about?
So currently we know that there are 2 individuals associated with this school who have contracted measles. We have not yet determined whether they were contracted at the school or contracted in the community.
Do you have a sense of doctors in the area seeing more people receiving?
So anecdotally, we have heard of an increased volume, but we have been unable to quantify it.
Dr. Barbot, how many people have you vaccinated? I remember the last number was around 7,000 people, and you had mentioned that it's doubled. Do you have a hard number?
So currently, we don't have a hard number. Like I said, anecdotally, we know it's going up. It is one of the numbers that we will be looking at to measure success.
But I just want to clarify the number I think that you were referring to from last press conference. It was about 8,000 more vaccines administered in Borough Park and Williamsburg this year as compared with last year.
So we know for Williamsburg it's 4,700.